Now, there are growing calls on healthcare workers to ensure that they give young people services without pressure that might discourage them in continuing using the services, including contraceptives. The youth is part of the non-government organizations that are continuing with various conversations on the sidelines of the 11th SAAIDS conference underway in Durban. According to the UNAIDS Global Aids report of 2022, of the 38 million people living with HIV globally, South Africa remains the epicenter of the pandemic, with 8 million people living with the virus. Now, let's have this discussion, perhaps take it further. We're joined via Zoom by the South African National AIDS Council Technical Lead for Treatment Literacy, Mandisa Dukashe. A very good afternoon to you, Mandisa. Thank you for your time with us here on the SABC.
Good afternoon, and thank you so much for having Sanik online. Thank you.
Let's look at some of the alarming stats coming through, and perhaps how we can find solutions going forward. Honing in on KwaZulu-Natal province, records over 1,300 new HIV infections per week amongst girls and young women. I mean, these are between the ages of 15 and 24. At this rate, would you say that we are winning the war against HIV and AIDS?
Yeah, there is a chance, there is a possibility, but depending on what the country is doing and is willing to engage on, we may not achieve the goal of ending AIDS by 2030, but progress will be made by then, obviously, and definitely, yes.
All right. So when we look at the stats that are coming through in KwaZulu-Natal province at this point, what measures need to be put in place, perhaps to ensure that the teenage pregnancies are lowered? Also looking at the HIV infection rates amongst women and young girls, what more could be done?
When we're talking teenage pregnancy or pregnancy of young girls, and it really needs some kind of very strict policies and interventions between different stakeholders. That is very key, because sometimes, this it may not be a teenage pregnancy, but it may be statutory rape, because when you're talking about a 14, 15-year-old, how would that young girl consent to sexual intercourse? So I think a number of times the people that are actually impregnating these young girls are older people, and when we're talking pregnancy, it means condoms were not used. So we're actually exposing them. They are vulnerable to pregnancy at a younger age. They are vulnerable to HIV, and there are a number of things, contributing factors, especially when you're talking about deep rural of KZN. So I think vulnerability is very key, and there are a number of interventions when you're talking. When a school going children, parents need to make sure that they're involved. Policymakers, teachers should be part of, because these kids cannot think for themselves, cannot protect themselves, but parents and the whole community should be involved in terms of protecting them. But in terms of HIV, it's quite worrisome, because again, these are older people that has been exposed to HIV and has been sleeping around, and they're taking advantage of these young people and sleeping with them, and sometimes they're giving them money in order for them to allow sex without condom. That is very, very worrisome. And these are all the people, as I'm saying, that are supposed to be protecting these young girls, and instead of protecting them, they're actually exposing them to all these issues, pregnancy and STIs and HIV.
No, absolutely. On the back of that, I mean, some of the stats coming through with regards to teenage pregnancy: 26,515 in the past 8 months for KwaZulu-Natal, the Northern Cape. More than 3,000 schoolgirls between the ages of 10 and 19 have fallen pregnant, and this was between 2022 and March 2023. We need to look at the various players along the value chain. At this point, what role can active parenting play to help curb or mitigate against the issues at hand?
Sometimes, parents can do to a certain point or to a certain stage. But I think what is very critical is our government to actually tighten, as I'm saying, issues of policies, issues of justice, because again, these people that are perpetrators, they need to be taken on board. And again, at times, I think I heard in news that a grandparent was the one that was selling 12, 14, 16-year-old to actually men that are working, and she will be the one when they go out and sleep throughout the weekend, sleep with these older people. The same grandmother will be the one to say, how much did you get? Give me that money. And what I like about that case is the whole community is actually up in arms to say that grandmother should be brought into justice. So we need communities, we need the ward councillors to be on board, community leaders is very, very important because, again, I think in some areas, when you're talking rural areas, there are certain topics that are elephants in the rooms when maybe what mothers, women are not allowed to talk about. And I think what is very critical and important is to have young people be at the center of developing community programs and have community programs funded. SANEC, we've got different sectors. We've got a youth sector that is very vibrant, that is very forward, but lack of capacity for these young-led organizations, lack of funding for these young organizations, because these people, they know exactly what are the issues. But in terms of coming up with strategies to intervene and stop all these issues, they do not have funding and resources. And it is for our government, our different funding agencies and different organizations in the community to recognize and ensure that these young people, the organizations that are led by young people, are empowered and capacitated and funded. That is very critical.
No, absolutely. Let me conclude this conversation. I want to look at where to from here. And there are obviously nearly 8 million South Africans on record who are living with HIV. And I wonder if we are still on track to meet the 95 targets, which aim to ensure that 95% of HIV positive people know their status. 95% of people obviously are diagnosed with HIV, received also sustained antiretroviral therapy, and also 95% of people on antiretroviral therapy have viral suppression. I mean, this was by that 2030 target. Help us understand that.
We're not on target. We're not online as well. I think where we are and where we are struggling is the second 95, where people with HIV, diagnosed with HIV, they're supposed to be put on treatment. We're really struggling. And I think back to the topic that we brought of young people sleeping probably with older men, getting pregnant and being infected with HIV. And then it means, I think when you look at the statistics again, men are not coming forward to test for HIV. Men are not coming forward to take treatment. So now this is one of the target population that will need to actually reach out and put them on treatment. They test, they don't start treatment, and some they don't even test. So in order for us to be aligned, in order for us to achieve the 95, testing people, putting them on treatment and making sure that they are virally suppressed. We're actually in the country looking at launching a U equals U undetectable equals untransmittable campaign, where we want to make sure that people, they know the benefit of treatment, starting treatment, the benefit of remaining on treatment. U equals mainly is a campaign that focuses on ensuring every person who tests HIV is on treatment and virally suppressed, so that we eliminate transmissions of HIV. So one of the key focus at this conference is to ensure that communities, different government departments, funding agency are up in arms. We are launching and taking the U equals message in communities, so that we make sure that, because U equals, we have to be 100% effective in eliminating HIV transmissions. This is what we're actually aiming into before the end of this year. This is exciting to actually learn that South Africa will be one of the first few African countries to launch U equals, which seeks to ensure that we are eliminating HIV transmissions, which of course will actually contribute to minimizing transmissions of HIV to young girls and boys.
Of course, and striving for an AIDS-free generation. Let's leave the conversation then. Thank you for your time with us here on the SABC. Mandisa Dukashe, South African National AIDS Council Technical Lead for Treatment Literacy, joining us. Of course, this is the 11th SA AIDS Conference is underway in Durban.